Welcome to day 4 of the 30-day NCLEX challenge. You've made it this far. Now let's keep the momentum going. Today, we're diving into 75 high-yield NCLEX questions that can make or break your exam. Miss this, and you might miss a question on the real test. Watch till the end, because every question brings you one step closer to passing NCLEX in your first try. Let's begin. To question number 1. A client is being discharged after treatment for a skin abscess that tested positive for methicillin-resistant Staphylococcus aureus, commonly known as MRSA. The nurse must ensure that the client understands how to prevent the spread of this resistant organism at home. So here's the question. Which instruction is most appropriate for the nurse to include in the discharge education? Here are the options. Option A, avoid using alcohol-based hand sanitizer. Option B, use disposable dishes and utensils for all meals. Option C, wear a surgical mask when you are out in public. Option D, keep the wound covered with a dry bandage. And now, the correct answer is option D, keep the wound covered with a dry bandage. Let us walk through the reasoning behind this choice. Option D is the most appropriate because MRSA is primarily spread through direct contact with an infected wound or with surfaces that have been contaminated by that wound. By keeping the wound clean, dry, and securely covered with a bandage, the client greatly reduces the risk of transmitting MRSA to others. This is particularly important in preventing the contamination of shared items such as linens, clothing, and furniture. Moving on to question number 2. The nurse is developing a post-operative care plan for a client who has undergone a lumbar laminectomy. Which of the following interventions should be included in the plan of care? Here are the options. Option A, log roll the client. Option B, apply a cervical collar. Option C, place an overhead trapeze on the bed. Option D, keep the client in high Fowler's position while in bed. The correct answer is option A, log roll the client. Let us explore the rationale behind this. Option A is the correct answer because log rolling is a technique used to move a client while maintaining spinal alignment, which is critical following lumbar spine surgery. It helps prevent twisting and shearing forces that could disrupt surgical repair or lead to nerve damage. This maneuver should be done with the assistance of at least 3 staff members to keep the client's spine aligned during movement. Let us take a closer look at question number 3. The nurse is caring for 4 assigned clients during the shift. Which client should the nurse assess first? Consider the following options. Option A, 30 minutes overdue to be ambulated in the hallway. Option B, refusing to eat their meal after receiving a glargine insulin injection. Option C, scheduled for discharge in 3 hours and needs transportation. Option D, requesting diphenhydramine after starting an intravenous antibiotic. The correct answer here is option D, requesting diphenhydramine after starting an intravenous antibiotic. Here is why this option takes priority. Option D indicates a potential allergic reaction to the antibiotic, possibly signaling early signs of hypersensitivity or even anaphylaxis. Administering diphenhydramine may address symptoms like itching or rash, but the nurse must immediately assess for more severe signs such as shortness of breath, wheezing, or swelling. Rapid identification and treatment are crucial to avoid life-threatening complications. Next up is question number 4, which brings us into the realm of critical care pharmacology. The nurse is caring for a client who is receiving a norepinephrine infusion. Which of the following statements most accurately explains the pharmacological action of norepinephrine? Let us examine the options. Option A. Norepinephrine primarily acts as a neurotransmitter in the central nervous system, regulating mood and emotions. Option B. Norepinephrine is a hormone produced by the adrenal cortex primarily involved in regulating blood pressure and heart rate. Option C. Norepinephrine is a neurotransmitter released by postganglionic sympathetic neurons, exerting effects on target organs via adrenergic receptors. Option D, norepinephrine is a hormone secreted by the posterior pituitary gland, responsible for regulating water balance and blood pressure. The correct answer here is option C. Norepinephrine is a neurotransmitter released by postganglionic sympathetic neurons, exerting effects on target organs via adrenergic receptors. Now, let us unpack why this answer is most accurate. Norepinephrine is a catecholamine with potent vasoconstrictive properties that acts on alpha-adrenergic receptors, leading to increased systemic vascular resistance and blood pressure. It also exerts mild beta-1 activity, improving myocardial contractility and cardiac output. This makes it especially useful for hypotensive clients in shock states. Let us now move on to question 5. The nurse is assessing a client who reports experiencing frequent nightmares, vivid flashbacks related to a past event, and persistent intrusive thoughts. Based on these symptoms, the client is at highest risk for developing which of the following mental health disorders? Here are the options. Option A, panic disorder. Option B, bipolar disorder. Option C, schizophrenia. Option D, post-traumatic stress disorder. And the correct answer is option D, post-traumatic stress disorder. Here's the rationale. This diagnosis is strongly supported by hallmark symptoms such as nightmares, flashbacks, and recurrent intrusive thoughts, all of which are central features of post-traumatic stress disorder, also known as PTSD. This condition often develops after a person experiences or witnesses a traumatic event, such as military combat, sexual assault, physical abuse, or serious injury. Clients with PTSD tend to re-experience the trauma involuntarily, and they may show intense emotional reactions, including fear, helplessness, and horror. If left untreated, PTSD can significantly impair the individual's sleep, emotional regulation, and daily functioning. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get. Daily live classes with expert instructors, over 500 hours of recorded lectures, 100 hours of animated crash course content for rapid revision, a massive bank of 5,000 previously asked NCLEX questions, 15 full-length mock tests to simulate the real exam, detailed NGN case study discussions to master the new format, plus complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now, it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry, this offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. And now, let us proceed to question 6. The nurse is assessing a client diagnosed with Guillain-Barré syndrome. Which of the following clinical findings should the nurse expect to observe? Here are the options. Option A, hyperreflexia. Option B, perseveration. Option C, dystonia. Option D, paresthesia. And the correct answer is option D, paresthesia. Here is the rationale. Paresthesia, described by clients as a tingling, numbness, or pins and needles sensation, is one of the earliest and most recognizable symptoms of Guillain-Barré syndrome. This condition is a rapidly progressive polyneuropathy that begins in the peripheral extremities and often ascends toward the upper body and respiratory muscles. Guillain-Barré is frequently preceded by a viral or bacterial infection, and it can cause a combination of motor weakness, autonomic instability, and sensory disturbances like paresthesia. Reflexes are typically diminished or absent. Let us now move forward with question number 7, which focuses on geriatric nursing assessment. When conducting a health history assessment of an older adult, the nurse should prioritize which of the following areas? Take a look at the options. Option A, birth history, immunizations, as well as growth and development. Option B, previous pregnancies, obstetrical history, and psychosocial factors. Option C, religion, spirituality, culture, and values. Option D, sensory deficits, illness history, and lifestyle factors. The correct answer is option D, sensory deficits, illness history, and lifestyle factors. Here is the explanation behind this choice. When assessing older adults, the most critical concerns relate to their functional and physiological status. Sensory changes such as hearing or vision loss can impact communication and compliance, while chronic illness patterns and lifestyle habits directly affect current and future care needs. By focusing on these aspects, nurses gain a comprehensive view of the client's health risks and maintenance strategies. Continuing with question number 8, let us now explore medication evaluation in mental health care. The nurse is caring for a client who has been prescribed carbamazepine. Which of the following clinical findings would best indicate that the medication is producing a therapeutic effect? Consider the options. Option A, decreased mood lability. Option B, steady gait. Option C, urinary continence. Option D, increased bone mass. The correct answer is option A, decreased mood lability. Here is the rationale. Carbamazepine is often used to manage bipolar disorder and seizure conditions, and one of its key psychiatric benefits is mood stabilization. When effective, it reduces the frequency and severity of emotional instability, particularly in bipolar clients. Now, shifting to question number 9, let us focus on infection control and personal protective equipment. The nurse is preparing to care for a client admitted with Haemophilus influenza I type B, or Hib, meningitis. Which personal protective equipment is appropriate for the nurse to use when entering the client's room? Here are the options. Option A, boot, shoe, covers. Option B, face shield. Option C, surgical mask. Option D, gown. The correct answer is option C, surgical mask. Let us break down the reason why. Hib meningitis is spread through large respiratory droplets and therefore requires droplet precautions. A surgical mask is necessary to protect against inhaling infectious droplets during client interaction. Let us tackle a bit of dosage calculation in question number 10. The primary healthcare provider has prescribed 200 milligrams of doxycycline to be infused over 1 hour. The pharmacy supplies the medication in an intravenous bag labeled 200 milligrams of doxycycline in 150 milliliters of normal saline. The IV tubing has a drop factor of 10 drops per milliliter. At what rate in drops per minute should the nurse set the IV flow? The correct answer is 25 drops per minute. Let us walk through the calculation. Using the formula, flow rate equals total volume in milliliters multiplied by the drop factor, divided by the time in minutes. Step 1, 150 milliliters times 10 drops per milliliter equals 1,500 drops. Step 2, divide 1,500 drops by 60 minutes to get 25 drops per minute. Option A would have been correct if you calculated it another way, but only option 25 drops per minute ensures the correct infusion rate over 1 hour. Clinical tip, always verify the tubing's drop factor and calculate carefully to avoid medication errors and ensure therapeutic effectiveness. Now let us turn our attention to question number 11, which deals with safe communication and critical values. While caring for a hospitalized client, the nurse receives a phone call from the laboratory reporting a critical sodium level of 122 milliequivalents per liter. What should be the nurse's first action? The choices are option A, notify the primary healthcare provider. Option B, initiate seizure precautions. Option C, read back the laboratory result to confirm accuracy. Option D, request a repeat specimen to validate the result. The correct answer is option C, read back the laboratory result to confirm accuracy. Here is why this is the first and most important step. Whenever a critical lab result is reported by phone, the nurse must verify the result through a read-back protocol to ensure there was no error in transmission. This helps prevent treatment based on miscommunication. While a sodium level of 122 is critically low and may lead to neurologic symptoms like confusion or seizures, no interventions should be initiated until the result is confirmed. Let us now transition into question number 12, where we dive into the critical care of a client diagnosed with syndrome of inappropriate antidiuretic hormone, or SIADH. During shift handoff, the oncoming nurse is informed that a newly assigned client has SIADH. Which nursing action is the highest priority when caring for this client? Let us look at the options. Option A, assess the patient's mental status. Option B, provide oral hygiene. Option C, keep accurate intake and output measurement. Option D, reduce stress and discomfort. The correct answer is option A, assess the patient's mental status. Now, here is the rationale. SIADH results in excessive antidiuretic hormone secretion, causing water retention and dilutional hyponatremia. As sodium levels drop, clients are at risk for cerebral edema and neurological changes such as confusion, restlessness, or seizures. The earliest indicator of worsening hyponatremia is a change in mental status, making neurologic assessment the top priority. Moving right along to question number 13, let us explore home safety concerns for clients on oxygen therapy. The nurse is conducting a home safety assessment for a client who is receiving supplemental oxygen. Which of the following items is essential to have in the home environment? Here are the choices. Option A, smoke detector. Option B, extension tubing. Option C, slip-resistant rugs. Option D, air humidifier. The correct answer is option A, smoke detector. Let us break down the reason. Although oxygen is not flammable itself, it significantly accelerates combustion. Even a tiny spark can cause a dangerous fire in the presence of enriched oxygen. Therefore, having a functioning smoke detector in the home is absolutely essential. Shifting gears now to question number 14, which covers procedural preparation and client understanding. The nurse has completed pre-procedure teaching for a client scheduled for a liver biopsy. Which of the following statements by the client indicates a correct understanding of the instructions? Take a look at the options. Option A, I will not be conscious during this procedure. Option B, I should not take any acetaminophen 1 week before this procedure. Option C, I will need to cough and deep breathe every 2 hours after this procedure. Option D, I may be asked to hold my breath during the insertion of the biopsy needle. The correct answer is option D. I may be asked to hold my breath during the insertion of the biopsy needle. Here is why this is correct. During a liver biopsy, clients are typically awake with local anesthesia. To minimize liver movement and avoid organ damage, the provider asks the client to exhale and hold their breath during the needle insertion. This technique stabilizes the liver and diaphragm. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get: daily live classes with expert instructors, over 500 hours of recorded lectures, 100 hours of animated crash course content for rapid revision, a massive bank of 5,000 previously asked NCLEX questions, 15 full-length mock tests to simulate the real exam, detailed NGN case study discussions to master the new format, plus complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry! This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Let us now dive into question number 15, which centers on child development and parental reassurance. During a routine wellness check, the mother of a 2-year-old boy expresses concern, saying, I do not understand why he just plays by himself. All his cousins play together, but he sits alone. Is something wrong with him? What is the nurse's most appropriate response? Consider the options. Option A, your child is a toddler. It is completely normal at this age to play independently, even when other children are nearby. Option B, did you try encouraging him to join in? Maybe he does not play with others because you are not prompting him enough. Option C, we can bring that up when the doctor comes in for his examination. Option D, it would be best for your child to be evaluated by a child psychologist. The correct answer is option A, your child is a toddler. It is completely normal at this age to play independently, even when other children are nearby. Here is the explanation. This stage of development is called parallel play, where toddlers engage in solitary or side-by-side play without direct interaction. It is entirely appropriate between 2 and 3 years of age. Now, let us focus on question number 16, where we examine high-risk drug reactions. While reviewing the potential side effects of adjuvant analgesic medications, the nurse identifies which of the following drug and adverse effect pairings as most accurately matched with its most serious complication. Let us go through the options. Option A, acetaminophen, gastrointestinal tract bleeding. Option B, ibuprofen, hepatic failure. Option C, clonidine, renal failure. Option D, aspirin, anaphylaxis. The correct answer is option D, aspirin, anaphylaxis. Let us explain why. Although aspirin is well known for causing gastrointestinal irritation and bleeding, its most severe complication is anaphylaxis. This hypersensitivity reaction can rapidly lead to airway obstruction, angioedema, bronchospasm, and cardiovascular collapse. Clients with aspirin-sensitive asthma are at particularly high risk. Let us now turn our focus to question number 17, where we address safety concerns related to fall risk. The nurse is caring for a group of assigned clients. Which client should the nurse identify as being at the highest risk for experiencing a fall? Here are the options. Option A, an 88-year-old admitted with a chest tube for pneumothorax and a history of dementia. Option B, a 44-year-old admitted with heart failure, has a peripheral intravenous line, and is receiving intravenous furosemide. Option C, a 33-year-old admitted with cholecystitis, has a peripheral intravenous line, and is receiving intravenous hydromorphone. Option D, a 28-year-old admitted with bacteremia, receiving intravenous fluids via central line and is diaphoretic. The correct answer is option A, an 88-year-old admitted with a chest tube for pneumothorax and a history of dementia. Now, here is why this client is the highest risk. Age alone is a major fall risk factor, and when combined with dementia, mobility challenges, and the physical obstacle of a chest tube, the risk multiplies. These clients often have impaired judgment, confusion, and reduced strength, all of which increase fall likelihood. Now let us transition into question number 18, which focuses on newborn care and preventive interventions. The nurse understands that vitamin K is routinely administered to newborns after birth. For which of the following reasons? Let us examine the choices. Option A, neonates are unable to synthesize vitamin K in the intestines due to the lack of normal bacterial flora. Option B, hemolysis occurs in neonates as a result of hepatic immaturity. Option C, neonates have reduced storage of vitamin B12 at birth. Option D, there is decreased iron storage in the liver and spleen of neonates. The correct answer is option A, neonates are unable to synthesize vitamin K in the intestines due to the lack of normal bacterial flora. Here is the rationale. At birth, a newborn's gastrointestinal tract is sterile and lacks the bacteria needed to produce vitamin K, which is essential for activating clotting factors like 2, 7, 9, and 10. Without supplementation, newborns are at risk for life-threatening bleeding known as vitamin K deficiency bleeding. Let us now move into question number 19, which highlights important post-operative care for infants following cleft lip surgery. The nurse is caring for a 6-month-old infant who has just returned to the unit following surgical repair of a cleft lip on the left side. Which position is most appropriate for the nurse to place the infant in post-operatively? Here are the choices. Option A, prone, on the stomach. Option B, supine, on the back. Option C, left side lying. Option D, right side lying. The correct answer is option D, right side lying. Here is why this position is safest. Placing the infant on the right side keeps pressure off the left-sided surgical site and protects the sutures. Additionally, side-lying positioning reduces the risk of aspiration, which is a concern after anesthesia or vomiting. Now, for question number 20, which delves into psychological defense mechanisms during client assessments. During a clinic intake interview, the nurse is assessing a client's behavior and emotional coping mechanisms. Which of the following responses best demonstrates the use of altruism as a defense mechanism? Here are the choices. Option A, justifying illogical ideas, actions, or feelings by developing acceptable explanations. Option B, reverting to an earlier, more primitive, and childlike pattern of behavior. Option C, channeling anger from an unacceptable activity to one that is acceptable. Option D, a largely unconscious motivation to feel caring and concern for others. The correct answer is option D, a largely unconscious motivation to feel caring and concern for others. Now, let us discuss the rationale. Altruism is a mature and healthy defense mechanism where a person copes with their own stress by helping others. This response is typically unconscious and is considered psychologically adaptive. For example, a person who lost a loved one may volunteer at a grief center to transform their own pain into empathy. And finally, let us look at question number 21, which touches on cardiovascular assessment and proper documentation. During a cardiovascular assessment, the nurse auscultates a harsh, blowing sound while listening to the client's heart tones. How should the nurse document this finding? Consider the options. Option A, pericardial friction rub. Option B, heart murmur. Option C, normal lub-dub sounds. Option D, S3 heart sound. The correct answer is option B, heart murmur. Here is why. A heart murmur is described as a harsh, blowing, or swooshing sound created by turbulent blood flow, usually due to structural defects like valvular stenosis or regurgitation. It is important to document murmurs based on location, intensity, pitch, and timing, such as systolic or diastolic. Let us now proceed to question number 22, which focuses on psychiatric medications and cardiovascular safety. The nurse is reviewing the medication list of a client with psychiatric symptoms. Which of the following medications is known to potentially cause a prolonged QT interval as an adverse effect? Here are the options. Option A, cariprazine. Option B, zypresidone. Option C, mirtazapine. Option D, diazepam. The correct answer is option B, ziprasidone. Now, let us understand why this is the best choice. Ziprasidone is an atypical antipsychotic that has been associated with prolongation of the QT interval, a condition that can lead to dangerous arrhythmias like torsades de pointes. This risk increases when a client has underlying cardiac issues, electrolyte disturbances such as low potassium or magnesium, or is taking other QT prolonging drugs. On the other hand, option A, cariprazine, although also an atypical antipsychotic, carries a significantly lower risk for QT prolongation. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get: daily live classes with expert instructors, over 500 hours of recorded lectures, 100 hours of animated crash course content for rapid revision, a massive bank of 5,000 previously asked NCLEX questions, 15 full-length mock tests to simulate the real exam, detailed NGN case study discussions to master the new format, plus complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry! This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Shifting our focus now to question number 23. We examine nutrition counseling in adolescent pregnancy. The nurse is counseling a pregnant adolescent who reports frequently eating at fast food restaurants. Which of the following recommendations should the nurse provide to help improve the client's nutritional intake while still accommodating her preferences? The options are: option A, choose French fries instead of a baked potato. Option B, select a cheeseburger rather than a regular hamburger. Option C, pick sandwiches instead of wraps. Option D, opt for breaded chicken instead of broiled chicken. The correct answer is option B, select a cheeseburger rather than a regular hamburger. Here is why this is the most appropriate choice. Although fast food is generally not recommended during pregnancy due to its unhealthy composition, making small, thoughtful substitutions can still support maternal and fetal health. By choosing a cheeseburger, the adolescent increases her intake of protein and calcium, 2 nutrients vital for fetal development and maternal bone support. Moving on to question number 24, let us examine a critical care scenario involving heart failure. The nurse is caring for a client admitted with an exacerbation of congestive heart failure. Which of the following vital sign changes would most likely indicate that the client is developing a serious complication? Option A, decrease in blood pressure. Option B, increase in temperature. Option C, decrease in respiratory rate. Option D, increase in blood pressure. The correct answer is option A, decrease in blood pressure. Let us break down the rationale. A drop in blood pressure in the context of worsening congestive heart failure signals a serious decline in cardiac output. This means the heart is no longer able to pump effectively, and compensatory mechanisms are failing. The result could be poor perfusion and potential progression to shock, demanding immediate medical attention. Now let us turn our attention to question number 25, which highlights the importance of timing in infection management. A client is admitted with a suspected respiratory infection after experiencing persistent cough, chills, and fever. Admission orders include a regular diet, vital signs every 4 hours, ampicillin 250 milligrams by mouth every 6 hours, and a sputum culture. Before administering the first dose of the antibiotic, which nursing action should the nurse take first? Option A, provide the client with a full meal. Option B, collect the sputum sample. Option C, assess the client's vital signs. Option D, assess the client's oxygen saturation. The correct answer is option B, collect the sputum sample. Here is the reasoning. Obtaining the culture before administering antibiotics is essential to ensure the laboratory can accurately identify the causative microorganism. Giving antibiotics first may interfere with results and hinder effective treatment. Finally, let us transition into question number 26, which deals with surgical recovery and immediate post-operative risks. The nurse is caring for a client who is in the immediate post-operative period following a colon resection with the creation of a colostomy. Which of the following potential complications should the nurse identify as the most critical to monitor for during this phase of recovery? Option A, infection. Option B, thermoregulation. Option C, hemorrhage. Option D, altered body image. The correct answer is option C, hemorrhage. Let us explore why. During the immediate post-operative period, the nurse must prioritize life-threatening complications. Hemorrhage, especially after abdominal surgery, poses a high risk for hypovolemic shock. The signs are often subtle but dangerous, such as a sudden drop in blood pressure, rapid pulse, pallor, and decreased urine output. Let us move forward now to question number 27, which emphasizes preventive education and cancer screening. The nurse is providing education to a 57-year-old client regarding screening recommendations for colorectal cancer. Which of the following statements should the nurse include during the teaching? Option A, it is recommended that colon cancer screening with a colonoscopy should begin at age 45. Option B, it is recommended that colon cancer screening with a colonoscopy should begin at age 70. Option C, it is recommended that colon cancer screening with a colonoscopy should begin at age 40. Option D, it is recommended that colon cancer screening with a colonoscopy should begin at age 65. The correct answer is option A. It is recommended that colon cancer screening with a colonoscopy should begin at age 45. Let us explore why this is the most accurate and up-to-date choice. The American Cancer Society recommends that individuals at average risk begin regular colorectal cancer screening at age 45, due to the increasing incidence of colorectal cancers in younger adults. Colonoscopy is considered the most comprehensive method because it not only allows direct visualization, but also enables polyp removal during the same procedure. Next, question number 28 tests your understanding of medication evaluation in cardiovascular care. The nurse is caring for a client who has been prescribed amlodipine. Which of the following assessment findings would indicate that the medication is producing a therapeutic effect? Option A, hemoglobin, A1C 5.6%. Option B, blood pressure 119 over 79 millimeters of mercury. Option C, capillary blood glucose 88 milligrams per deciliter. Option D, total cholesterol 190 milligrams per deciliter. The correct answer is option B, blood pressure 119 over 79 millimeters of mercury. Let us understand the rationale behind this. Amlodipine is a calcium channel blocker prescribed to lower blood pressure and relieve angina by relaxing vascular smooth muscle. A blood pressure within the optimal range, like 119 over 79, is a clear indication that the medication is working effectively. Let us now continue with question number 29, which explores safe nursing practice and supervision of novice nurses. The nurse preceptor is observing a newly hired nurse provide care for a group of assigned clients. Which of the following actions by the newly hired nurse would require the preceptor to intervene? Option A, humidifying nasal cannula oxygen for a client with sarcoidosis. Option B, securing a suprapubic catheter to the client's inner thigh. Option C, placing a client with varicella zoster in airborne and contact isolation. Option D, suctioning a tracheostomy for 10 seconds while withdrawing the catheter. The correct answer is option B, securing a suprapubic catheter to the client's inner thigh. Now let us break this down. A suprapubic catheter should be secured to the lower abdomen, not the thigh, to avoid tension at the insertion site, reduce the risk of dislodgement, and prevent infection. Now on to question number 30, which presents an urgent peripheral vascular scenario. The nurse is assessing a client and notes signs suggestive of a femoral artery occlusion. Which action should the nurse take first? Option A, elevate the affected leg. Option B, apply a cold compress. Option C, notify the primary healthcare provider immediately. Option D, perform passive range of motion on the affected leg. The correct answer is option C, notify the primary healthcare provider immediately. Let us understand why this is a top priority. A femoral artery occlusion can cause a sudden and complete loss of blood flow to the leg. Classic symptoms include pain, pallor, pulselessness, paresthesia, paralysis, and a cool temperature, often called the 6 Ps. This condition can quickly lead to tissue death and even amputation if not urgently treated. Finally, let us move our attention to this segment with question number 31, which focuses on maternal physiology and hormone effects. Relaxin is a hormone released throughout pregnancy to help soften and relax the ligaments in the uterus and pelvis, allowing room for fetal growth and preparation for childbirth. However, one potential downside of relaxin is that it may, option A, cause high blood pressure in some women. Option B, lead to musculoskeletal injury due to loose ligaments. Option C, make urination more difficult than usual. Option D, increase bowel motility. The correct answer is option B, lead to musculoskeletal injury due to loose ligaments. Here is why. Relaxin increases ligament flexibility to allow for pelvic expansion, which is beneficial for labor. However, it also reduces joint stability, increasing the risk of falls, back strain, and ligament injuries. Many pregnant individuals report joint pain or clumsiness as a result. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get. Daily live classes with expert instructors. Over 500 hours of recorded lectures. 100 hours of animated crash course content for rapid revision. A massive bank of 5,000 previously asked NCLEX questions. 15 full-length mock tests to simulate the real exam. Detailed NGN case study discussions to master the new format. Plus, complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now, it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry. This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Let us now continue to question number 32, which explores the biochemical relationship between calcium and phosphorus in client care. The nurse is administering phosphate-excreting medication to a client who has hypocalcemia. What is the rationale for using this type of medication in the treatment plan? Option A, as phosphorus exits the body, calcium is also excreted. Option B, calcium is controlled by the excretion of phosphorus. Option C, when serum phosphorus decreases, serum calcium increases. Option D, phosphorus must be above 4.5 milligrams per deciliter before calcium levels can rise. The correct answer is option C, when serum phosphorus decreases, serum calcium increases. Now, let us explore why this is the case. Calcium and phosphorus exist in an inverse relationship within the body. When phosphorus levels are elevated, it binds with calcium in the blood to form insoluble complexes, thereby decreasing the amount of free, usable calcium. By lowering phosphorus with medications that bind or excrete it, calcium becomes more available. Transitioning into question number 33, we shift our focus to priority teaching for a client newly diagnosed with type 1 diabetes mellitus. The nurse is providing education to this client. Which of the following teaching points is most essential for the client to understand at this time? Option A, check hemoglobin. A1C levels every 3 months. Option B, rotate insulin injection sites regularly. Option C, examine your feet daily using a mirror. Option D, recognize the signs and symptoms of hypoglycemia. The correct answer is option D, recognize the signs and symptoms of hypoglycemia. Let us unpack why this is the most urgent priority. Hypoglycemia is a potentially life-threatening complication of insulin therapy that can occur suddenly, especially in those newly starting insulin. Clients must be able to quickly identify symptoms such as shakiness, sweating, irritability, confusion, and even seizures or loss of consciousness. Immediate recognition and treatment with fast-acting carbohydrates are critical to preventing emergencies. Next, question number 34 brings us into the realm of neurological emergencies. The nurse is caring for a client who has sustained a basilar skull fracture. Which assessment finding warrants the most immediate follow-up by the nurse? Option A, periorbital ecchymosis. Option B, retroauricular ecchymosis. Option C, elevated temperature of 100.9 degrees Fahrenheit or 38.3 degrees Celsius. Option D, headache. The correct answer is option C, elevated temperature of 100.9 degrees Fahrenheit. Now, let us explain why this symptom is a red flag. A fever in a client with a basilar skull fracture may indicate that meningitis is developing. Because this type of fracture can tear the meninges, it creates an open pathway for bacteria to enter the central nervous system through the nasal or ear cavities. Especially if cerebrospinal fluid leakage is present, prompt intervention is essential to prevent life-threatening complications. Now, let us turn to question number 35, which addresses cultural competence and accurate assessment in pediatric care. The nurse is assessing an infant with dark skin for signs of jaundice. Which area should the nurse examine to most accurately assess for this condition? Option A, hard palate of the mouth. Option B, lower back and sacral area. Option C, lower legs just below the knee. Option D, nail beds. The correct answer is option A, hard palate of the mouth. Here is why this is the most appropriate location. In infants with darker skin tones, yellowing of the skin may not be easily visible. Instead, jaundice is best detected by examining lighter pigmented areas like the sclera or the hard palate, where bilirubin accumulation is more noticeable. Finally, let us wrap up this segment with question number 36, which focuses on intrapartum care and fetal safety. A client at 39 weeks gestation experiences spontaneous rupture of membranes while ambulating to the bathroom. After she returns to bed, which nursing action should take priority? Option A, assess the color of the amniotic fluid. Option B, perform a vaginal examination to evaluate cervical dilation. Option C, place the client on strict bed rest until further notice. Option D, assess the fetal heart tones. The correct answer is option D, assess the fetal heart tones. Let us understand why this is the immediate nursing priority. The rupture of membranes can sometimes lead to cord prolapse, a rare but critical complication that places the fetus at risk for hypoxia. The quickest way to assess fetal well-being is by checking the fetal heart rate for any signs of distress such as bradycardia or variable decelerations. Let us now proceed to question number 37, which focuses on culturally sensitive post-mortem care. The nurse is caring for a client of the Islamic faith who has just passed away. Which of the following actions is most appropriate for the nurse to take in accordance with Islamic customs? Option A, prepare the client for cremation. Option B, position the client to face Mecca. Option C, leave the client's eyelids open. Option D, leave the client's body uncovered. The correct answer is option B, position the client to face Mecca. Here is why this is the most respectful and appropriate choice. In Islamic tradition, it is customary for the deceased to be positioned so that their head faces Mecca, the holiest city in Islam. This direction, known as the Qibla, holds deep spiritual meaning and should be honored whenever possible. Now let us turn to question number 38, which emphasizes early prenatal risk assessment. A nurse in a gynecology clinic is assessing a first-time client, Gravida 1, Para 0, who is 8 weeks pregnant. Which of the following findings would most likely indicate a potential high-risk pregnancy and require immediate follow-up? Option A, the client reports experiencing nausea and vomiting 4 to 5 mornings per week. Option B, the client expresses feelings of ambivalence about her pregnancy. Option C, the client reports intermittent constipation since learning she was pregnant. Option D, the client reports intermittent vaginal spotting accompanied by abdominal cramping. The correct answer is option D, the client reports intermittent vaginal spotting accompanied by abdominal cramping. Let us break this down. While some spotting in early pregnancy may be benign, when it is combined with abdominal cramping or back pain, it raises concern for a threatened abortion or even ectopic pregnancy. This finding must be urgently reported for evaluation through ultrasound and laboratory tests. Moving on to question number 39, we now look at safe practices in parenteral nutrition. A newly hired nurse is caring for a client receiving total parenteral nutrition. Which action by the nurse would require the preceptor to intervene? Option A, wearing a surgical mask while changing the client's central vascular access dressing. Option B, obtaining the client's capillary blood glucose every 4 to 6 hours. Option C, spiking and priming a new TPN bag without using an inline filter. Option D, continuing the TPN infusion via an infusion pump during a scheduled computed tomography scan. The correct answer is option C, spiking and priming a new TPN bag without using an inline filter. Let us understand why. TPN solutions are hypertonic and contain multiple nutrients, which create a rich environment for microbial growth. An inline filter is essential to protect against particulate matter, microbial contamination, and air emboli. Omitting this step compromises sterility and client safety. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get. Daily live classes with expert instructors. Over 500 hours of recorded lectures. 100 hours of animated crash course content for rapid revision. A massive bank of 5,000 previously asked NCLEX questions. 15 full-length mock tests to simulate the real exam. Detailed NGN case study discussions to master the new format. Plus, complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry. This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Let us now transition into question number 40, which highlights procedural safety during central line removal. The nurse is preparing to remove an internal jugular, central venous catheter. Which client position is most appropriate during this procedure to ensure safety? Option A, reverse Trendelenburg. Option B, left lateral decubitus. Option C, Trendelenburg. Option D, high Fowler's. The correct answer is option C, Trendelenburg. Here's the rationale. The Trendelenburg position lowers the head below the level of the heart, increasing venous pressure and reducing the risk of air embolism when the central line is removed. This position, paired with the Valsalva maneuver, where the client holds their breath during removal, helps prevent air from entering the venous circulation. Now, let us examine question number 41, which deals with telemetry interpretation and immediate nursing response. While observing a client on continuous cardiac monitoring, the nurse notes that the monitor alarm sounds and no QRS complexes are visible on the screen. What should be the nurse's immediate action? Option A, press the record button on the electrocardiogram. Option B, check the client's cardiac monitor lead placement. Option C, activate the code blue response. Option D, notify the healthcare provider immediately. The correct answer is option B, check the client's cardiac monitor lead placement. Let us explore why. When a monitor shows no rhythm or an abnormal tracing, the very first step is to assess whether the issue is technical, such as a loose or disconnected lead, before assuming a clinical emergency. This prevents false alarms and unnecessary code activations. Finally, question number 42 emphasizes the 5 rights of medication safety. The nurse is preparing to administer a prescribed medication to a client. After verifying the right medication, dose, route, and time, which action should the nurse take next to ensure safe administration? Option A, confirm the client's identity using 2 identifiers. Option B, explain the purpose and possible side effects of the medication. Option C, check that the medication is not expired. Option D, document the medication administration in the client's medical record. The correct answer is option A, confirm the client's identity using 2 identifiers. Here is why this step is non-negotiable. Confirming the right patient using full name, date of birth, or medical record number is the 5th right of medication administration. It ensures the medication is being given to the correct individual and prevents potentially life-threatening errors. Let us now move into question number 43, which integrates pediatric assessment and infectious disease recognition. A nurse is assessing an 8-year-old child who presents with bilateral knee pain and visible joint swelling. The parent reports that the swelling appeared suddenly and is worsening, and the child has a history of outdoor play in wooded rural areas. The nurse suspects Lyme disease. Which of the following assessment questions is most important to help support this presumptive diagnosis? Option A, has your child experienced any pain in the lower back or changes in urination, such as reduced urine output? Option B, has your child had any episodes of extremely high fever, such as above 39.5 degrees Celsius, lasting several days? Option C, have you seen any new rashes on the palms of the hands or soles of the feet recently? Option D, has your child complained of fatigue, headaches, body aches, or a recent sore throat? The correct answer is option D. Has your child complained of fatigue, headaches, body aches, or a recent sore throat? Here is why this is the most relevant question. Early disseminated Lyme disease often presents with vague flu-like symptoms such as fatigue, low-grade fever, malaise, headaches, and generalized body aches, sometimes progressing to joint involvement like knee swelling. These symptoms may be mistaken for viral illnesses unless a tick exposure history is explored. Next, in question number 44, we shift to hospital fire safety protocol. A A nurse walks into a patient's room and discovers visible flames and smoke emerging from an electrical outlet. The room is rapidly filling with smoke, and the client appears disoriented, but is conscious. What should the nurse do first? Option A, immediately evacuate the client from the room to a safe location in the hallway. Option B, attempt to extinguish the fire using the nearest fire extinguisher. Option C, activate the facility's fire alarm system. Option D, throw a standard linen sheet over the flames to attempt containment. The correct answer is Option A, immediately evacuate the client from the room to a safe location in the hallway. This action reflects the first step in the RACE protocol: rescue, alarm, confine, and extinguish. Protecting life always comes before alerting the facility or attempting to put out the fire. The nurse must act quickly to prevent injury from smoke inhalation or burns. Now let us turn to question number 45, which focuses on pain management and safe use of patient-controlled analgesia. A nurse is reviewing PCA pump settings following a recent in-service. Which of the following statements reflects a correct and clinically sound understanding of PCA usage? Option A, an initial loading dose may be prescribed to achieve therapeutic drug levels before the patient begins self-administering doses. Option B, PCAs are not recommended for patients experiencing acute pain due to the risk of overdose. Option C, the use of a PCA eliminates the need for routine nursing pain assessments. Option D, a continuous basal rate on a PCA pump lowers the likelihood of opioid-related complications. The correct answer is Option A. An initial loading dose may be prescribed to achieve therapeutic drug levels before the patient begins self-administering doses. This is correct because the provider may prescribe a loading dose to ensure effective pain control before patient-activated dosing begins. This is particularly important in the immediate post-operative period or during severe acute pain. Let us continue with question number 46, which addresses colostomy self-care teaching. A nurse is reinforcing discharge education for a post-operative client with a new colostomy. Which of the following statements made by the client indicates a need for further teaching and would require the nurse to intervene? Option A, if I notice my stoma turning bluish or purple, I will contact my primary care provider immediately. Option B, I plan to reintroduce high-fiber foods slowly to prevent cramping and excess gas. Option C, it is important that I keep a colostomy pouch over my stoma at all times. Option D, to clean the skin around my stoma, I will use rubbing alcohol for better disinfection. The correct answer is Option D. To clean the skin around my stoma, I will use rubbing alcohol for better disinfection. Let us explain why this is concerning. Rubbing alcohol can irritate and dry out the delicate peristomal skin, increasing the risk for breakdown and poor adhesion of the colostomy appliance. Clients should use mild soap and water, avoiding harsh agents like alcohol or hydrogen peroxide. Finally, let us conclude this segment with question number 47, which emphasizes medication safety and patient education. A home health nurse is assessing a client recently started on multiple antihypertensive agents, including a loop diuretic, a beta blocker, a thiazide diuretic, and a transdermal alpha agonist. Which of the following client statements indicates a potential safety concern and warrants immediate follow-up? Option A, since starting metoprolol, I noticed my heart rate is lower than usual. Option B, I usually take my furosemide right before going to bed at night. Option C, I have been flavoring my meals with potassium-based salt substitutes while taking hydrochlorothiazide. Option D, I apply my clonidine patch once a week and leave it on for 7 days. The correct answer is Option B, I usually take my furosemide right before going to bed at night. Here is why this is unsafe. Furosemide causes significant diuresis, and taking it at bedtime greatly increases the risk of nocturia, interrupted sleep, and falls, especially among older adults. This medication should be taken in the morning or early afternoon. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get: daily live classes with expert instructors, over 500 hours of recorded lectures, 100 hours of animated crash course content for rapid revision, a massive bank of 5,000 previously asked NCLEX questions, 15 full-length mock tests to simulate the real exam, detailed NGN case study discussions to master the new format, plus complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry! This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Let us begin this segment with question number 48, which focuses on rapid prioritization and clinical instability. The nurse is evaluating multiple post-medication clients during a busy medical surgical shift. Which client condition requires immediate nursing intervention to prevent life-threatening deterioration? Option A, a client receiving amphotericin B infusion who reports nausea and general malaise. Option B, a client who just received subcutaneous rapid-acting insulin and suddenly develops palpitations and lightheadedness. Option C, a client who has become drowsy after administration of intravenous fentanyl for post-operative pain. Option D, a client receiving intravenous dexamethasone who complains of a burning, itchy sensation in the perineal region. The correct answer is Option B, a client who just received subcutaneous rapid-acting insulin and suddenly develops palpitations and lightheadedness. Here is why this situation is a red flag. These symptoms suggest acute hypoglycemia, a medical emergency that can quickly escalate to seizures, loss of consciousness, or coma if untreated. Immediate rechecking of blood glucose and administration of a fast-acting carbohydrate is required. Now let us continue with question number 49, which challenges the nurse's pharmacology and advocacy skills. The nurse is reviewing new prescriptions for a client recently diagnosed with Raynaud's phenomenon, a condition characterized by episodic vasospasm. The provider prescribes ephedrine for symptomatic relief. What is the most appropriate nursing action at this time? Option A, offer nutritional counseling tailored to vasospastic disorders. Option B, clarify the prescription with the provider before administration. Option C, educate the client on potential side effects of ephedrine therapy. Option D, administer the first dose of ephedrine as ordered and document response. The correct answer is Option B, clarify the prescription with the provider before administration. Here is the rationale. Ephedrine is a vasoconstrictor and may worsen Raynaud's by further decreasing peripheral blood flow. Administering this drug could lead to ischemia in already compromised extremities. The nurse must recognize this contraindication and speak up before harm occurs. Shifting gears now to question number 50, we address pediatric medication safety. A 3-year-old child is receiving oral digoxin for congenital heart failure. During the nurse's assessment, which clinical finding would be the most concerning early indicator of digoxin toxicity? Option A, complaint of feeling dizzy during activity. Option B, new onset elevated heart rate with restlessness. Option C, sudden episode of vomiting without other gastrointestinal symptoms. Option D, flattened growth percentile and poor weight gain. The correct answer is Option C, sudden episode of vomiting without other gastrointestinal symptoms. Let us break this down. Vomiting is a common early sign of digoxin toxicity in children and must never be overlooked. Pediatric clients often cannot articulate symptoms like visual changes or dizziness, so the nurse must be alert for subtle cues like isolated vomiting. Let us now explore question number 51, which examines psychopharmacology and treatment-resistant depression. A client with a history of mood disturbance has been prescribed a monoamine oxidase inhibitor. Based on the therapeutic class of this medication, the nurse anticipates it will most likely be used in the management of which condition? Option A, cluster B personality disorder, presenting with emotional dysregulation. Option B, major depressive disorder unresponsive to first-line antidepressants. Option C, psychotic features associated with schizophrenia spectrum disorders. Option D, acute manic episode in a client with bipolar type 1 disorder. The correct answer is Option B, major depressive disorder unresponsive to first-line antidepressants. Here is the reasoning. MAOIs like phenelzine or trenylcypromine are used in treatment-resistant depression when SSRIs or SNRIs fail. They increase monoamine levels in the brain but require strict dietary restrictions due to the risk of hypertensive crisis from tyramine-containing foods. Finally, we move on to question number 52, which evaluates fluid and electrolyte priorities. The nurse is preparing to assess 4 assigned clients. Which client is at greatest risk for developing hypokalemia and requires close monitoring? Option A, A pregnant client hospitalized with hyperemesis gravidarum and ongoing severe vomiting. Option B, a client with stage 5 chronic kidney disease undergoing dialysis. Option C, a client admitted with diabetic ketoacidosis before insulin therapy. Option D, a client with full-thickness burns sustained within the last 12 hours. The correct answer is option A, a pregnant client hospitalized with hyperemesis gravidarum and ongoing severe vomiting. This is a classic scenario for potassium depletion. Excess vomiting leads to loss of gastric acids and potassium, and metabolic alkalosis can further push potassium into cells, reducing serum levels even more. Let us now move forward to question number 53, which focuses on patient safety and behavioral emergency response. A hospitalized client becomes increasingly agitated and physically aggressive, attempting to strike nursing staff and posing an immediate threat to safety. After unsuccessful de-escalation attempts, the healthcare provider authorizes the use of physical restraints. Which type of restraint is the most appropriate initial choice for this client's level of aggression? Option A, soft bilateral wrist restraints secured to the bed frame. Option B, mitt-style hand restraints applied to prevent tube removal. Option C, elbow immobilizers used to restrict arm flexion. Option D, waist restraint belt with side straps for bed security. The correct answer is option A, soft bilateral wrist restraints secured to the bed frame. Here is why this is the most appropriate intervention. When a client is physically violent and poses a risk to others, wrist restraints provide necessary limb control to prevent injury. This restraint type allows for immobilization while permitting ongoing assessment of neurovascular status. Now turning to question number 54, we explore contraceptive education and pregnancy prevention. A 28-year-old woman has just been prescribed a combined oral contraceptive pill. During discharge teaching, what is the most appropriate initial instruction the nurse should emphasize? Option A, once you begin the pill pack, you are immediately protected from pregnancy. Option B, you should use a backup form of contraception for the first 7 days after starting the pills. Option C, start with 2 pills today and take 2 more tomorrow to establish a baseline dose. Option D, you may experience breakthrough bleeding due to a rise in estrogen levels from the pill. The correct answer is option B. You should use a backup form of contraception for the first 7 days after starting the pills. Here is the rationale. Combined oral contraceptives are not immediately effective unless started on the first day of menstruation. Therefore, clients need to use a barrier method, such as condoms, during the first 7 days to avoid unintended pregnancy. Let us now continue with question number 55, which highlights pediatric chronic disease management. The nurse is conducting discharge education for the parents of a school-aged child newly diagnosed with cystic fibrosis. Which parental statement indicates a need for further teaching regarding respiratory care? Option A, we should start chest physiotherapy before giving the bronchodilator to loosen the mucus first. Option B, we will give the bronchodilator inhaler before any physical activity like running or biking. Option C, if the bronchodilator is given too late in the evening, it might affect our child's sleep. Option D, we plan to encourage extra fluids when our child has a cold or respiratory infection. The correct answer is option A. We should start chest physiotherapy before giving the bronchodilator to loosen the mucus first. Let us explain why this needs clarification. Bronchodilators should always be given first in the sequence of respiratory therapy, as they open the airways and allow for better mucus mobilization during chest physiotherapy. Doing physiotherapy first limits the effectiveness of mucus clearance. Finally, let us wrap up this segment with question number 56, which focuses on infection prevention following bone marrow transplantation. A client is in the immediate post-transplant phase after an allogeneic hematopoietic stem cell transplant for leukemia. Due to significant immunosuppression, the nurse anticipates the healthcare provider will prescribe which of the following medications as part of infection prophylaxis? Option A, desmopressin, to reduce risk of fluid imbalance. Option B, montelukast, to prevent bronchospasm during activity. Option C, zidovudin, to suppress viral replication in HIV. Option D, azithromycin, to prevent pulmonary bacterial infections. The correct answer is option D, azithromycin, to prevent pulmonary bacterial infections. Here is the reasoning. Post-transplant clients are highly vulnerable to opportunistic infections, particularly during periods of neutropenia. Azithromycin is a macrolide antibiotic known for its efficacy against atypical respiratory pathogens and is often used as prophylaxis to prevent bacterial pneumonia. Let us now explore question 57, which focuses on pediatric urinary management. A nurse in a pediatric clinic is developing a care plan for an 8-year-old child who presents with persistent primary nocturnal enuresis. Despite successful daytime toilet training, the child has no signs of urinary tract infection or structural abnormalities on evaluation. Which of the following parent-led interventions should the nurse prioritize to assist in identifying contributing factors and guide long-term management? Option A. Maintain a structured bladder diary to track urination and fluid intake patterns. Option B. Use nighttime diapers to minimize bedwetting incidents and simplify cleanup. Option C. Punish or scold the child following episodes of nighttime incontinence. Option D. Encourage the child to consume fluids before bedtime to increase bladder endurance. The correct answer is Option A. Maintain a structured bladder diary to track urination and fluid intake patterns. This strategy provides valuable insight into patterns that can guide behavior modification, fluid management, and medical interventions. Continuing to question 58, we examine pharmacologic intervention for nocturnal enuresis. A school-aged child diagnosed with primary monosymptomatic nocturnal enuresis has shown no improvement despite consistent behavioral interventions, including fluid restriction, scheduled voiding, and enuresis alarms. The nurse anticipates that the healthcare provider will now prescribe which pharmacologic agent to reduce nighttime urinary episodes? Option A. Bethanicol. Option B. Desmopressin. Option C. Prazosin. Option D. Finasteride. The correct answer is Option B. Desmopressin. Desmopressin is a synthetic analog of antidiuretic hormone that reduces nocturnal urine output and is reserved for cases unresponsive to behavioral strategies. Moving on to question 59, we shift our attention to abdominal assessment. During a comprehensive abdominal assessment, the nurse uses percussion to evaluate underlying structures in all 4 quadrants. Which percussion tone should the nurse expect to be the predominant sound across the majority of the abdomen in a healthy adult? Option A. Hyperresonance. Option B. Tympany. Option C. Resonance. Option D. Dullness. The correct answer is Option B. Tympany. Tympany is the drum-like, high-pitched sound heard over air-filled structures like the intestines and is normal in most abdominal quadrants. Let us now examine question 60, which highlights prenatal risk identification. A nurse in the antenatal clinic is reviewing the prenatal history of a pregnant client to assess for obstetric risk factors. Which of the following maternal conditions is most associated with an increased risk for placenta previa? Option A. Chronic cocaine use during pregnancy. Option B. Polycystic ovary syndrome diagnosed before conception. Option C. First-time pregnancy with no prior obstetric history. Option D. Gestational diabetes diagnosed during the 2nd trimester. The correct answer is Option A. Chronic cocaine use during pregnancy. Cocaine is a vasoconstrictor that interferes with placental implantation and is a known risk factor for both placenta previa and abruption. Transitioning into question 61, we address anticoagulation-related complications. A hospitalized client develops a significant drop in platelet count on day 5 of anticoagulant therapy, accompanied by new-onset deep vein thrombosis. The nurse suspects heparin-induced thrombocytopenia, HIT. Based on the client's current medication regimen, which of the following drugs is most likely responsible for this adverse immune reaction? Option A. Epoetin alpha. Option B. Clopidogrel. Option C. Iron dextran. Option D. Enoxaparin sodium. The correct answer is Option D. Enoxaparin sodium. As a low molecular weight heparin, enoxaparin can trigger HIT, an immune response that causes platelet destruction and increases the risk of thrombosis. Continuing with question 62, we focus on balance and safety in neurological conditions. A nurse is caring for a client newly diagnosed with Meniere's disease who reports severe episodic vertigo, tinnitus, and a sensation of ear fullness. The client is ambulating unassisted in the room. Which nursing action is the most immediate priority to reduce the risk of a serious complication? Option A. Provide client education on the pathophysiology of Meniere's disease and potential long-term outcomes. Option B. Implement strict fall precautions, including use of assistive devices and supervision during ambulation. Option C, reassure the client and use distraction techniques to reduce anxiety during acute attacks. Option D, initiate dietary education focusing on sodium restriction and fluid balance. The correct answer is option B, implement strict fall precautions including use of assistive devices and supervision during ambulation. Fall risk from vertigo is the most immediate danger, and safety must take precedence. Before we jump into next questions, here's something that can truly change your NCLEX journey. If you're serious about passing the NCLEX on your very first attempt, then now is the time to enroll in our complete NCLEX crash course. Here's what you'll get: daily live classes with expert instructors, over 500 hours of recorded lectures, 100 hours of animated crash course content for rapid revision, a massive bank of 5,000 previously asked NCLEX questions, 15 full-length mock tests to simulate the real exam, detailed NGN case study discussions to master the new format, plus complete access to PDF notes, exclusive EBOOKS, and a personalized study planner. And here's the best part. More than 1 lakh nurses across the world have cleared the NCLEX using this shortcut. Now it's your turn. For a limited time only, we're giving you a massive 70% discount on the course fee. But hurry! This offer is valid for just a few days. Click the link in the description and enroll today. Let's make your NCLEX success a reality. Now moving to question 63, which involves emergency management of inhalation injuries. A client is brought to the emergency department from a house fire and is exhibiting headache, confusion, flushed skin, and a cherry red appearance around the lips. Suspecting carbon monoxide poisoning, which nursing intervention should the nurse prioritize to address the most life-threatening aspect of this condition? Option A, initiate continuous pulse oximetry monitoring to assess oxygenation trends. Option B, administer 100% oxygen via non-rebreather mask at 15 liters per minute. Option C, establish intravenous access to begin blood work and potential fluid therapy. Option D, obtain a 12-lead electrocardiogram to evaluate for hypoxia-induced cardiac injury. The correct answer is option B, administer 100% oxygen via non-rebreather mask at 15 liters per minute. This therapy rapidly displaces carbon monoxide from hemoglobin, restoring oxygen transport. Lastly, question 64 turns our focus to endocrine pharmacology. The nurse is reviewing the medication profile of a client newly prescribed sitagliptin. Based on the drug's mechanism of action and therapeutic classification, the nurse should recognize that this medication is primarily used in the management of which condition? Option A, hyperlipidemia associated with metabolic syndrome. Option B, type 2 diabetes mellitus with suboptimal glycemic control. Option C, primary hypothyroidism with elevated thyroid-stimulating hormone. Option D, Stage 1, hypertension with systolic pressure above 140 millimeters of mercury. The correct answer is option B, type 2 diabetes mellitus with suboptimal glycemic control. Sitagliptin is a DPP-4 inhibitor that enhances incretin activity to promote insulin secretion and reduce glucagon. Let us now shift to question 65. A nurse sustains a needle stick injury while initiating a peripheral intravenous catheter on a hospitalized client. Which immediate action demonstrates appropriate adherence to occupational safety protocols? Here are the options. Option A, inquire whether the client has a history of hepatitis A infection. Option B, thoroughly cleanse the injury site with soap and running water without delay. Option C, record the incident in the client's electronic health record as a procedural complication. Option D, remove the vascular access device and discard it to prevent contamination. And the correct answer is Option B, thoroughly cleanse the injury site with soap and running water without delay. Here is the rationale. The priority nursing response to a sharps or needle stick injury is immediate cleansing of the affected area using soap and water under running water. This helps reduce surface contamination and lowers the risk of pathogen absorption. After cleansing, the nurse should promptly report the incident to a supervisor, initiate the facility's exposure control protocol, and prepare for possible post-exposure prophylaxis for HIV, hepatitis B, or hepatitis C, depending on the client's infection status. Now moving on to question 66. A nurse is evaluating a female client with a complete spinal cord injury at the C6 to C7 level who is currently undergoing inpatient physical rehabilitation. Which observed behavior or client statement provides the most objective evidence of progress in physical therapy? Here are the options. Option A, the client successfully navigates the therapy room using a motorized wheelchair with adaptive controls. Option B, the client expresses a desire to stand with assistance during future therapy sessions. Option C, the client verbalizes an intention to attempt voluntary toe movements despite paralysis. Option D, the client reports recent improvement in bladder sensation and reduced urgency. And the correct answer is option A. The client successfully navigates the therapy room using a motorized wheelchair with adaptive controls. Here is the rationale. This choice reflects a functional, measurable improvement in upper extremity motor skills and coordination, which aligns with physical therapy goals for clients with complete C6 to C7 spinal cord injuries. At this neurological level, clients may retain partial innervation of the wrist extensors and some finger extensors, allowing for independent wheelchair mobility, especially with adaptive devices. Mastering control of a power wheelchair is a key milestone that enhances independence, community reintegration, and overall quality of life. Heading into question 67. During a comprehensive pain assessment, the nurse notes that the client describes their pain as crushing and sharp. The nurse understands that accurately interpreting this pain quality is crucial for identifying the underlying cause and selecting the right interventions. So, based on the client's sensory descriptors, which category of pain is most consistent with what was reported? Here are the options. Option A, somatic nociceptive pain. Option B, deep visceral pain. Option C, cardiac-related ischemic pain. Option D, neuropathic pain of central origin. And the correct answer is option A, somatic nociceptive pain. Here is the rationale. Somatic pain originates from the skin, muscles, bones, or connective tissue. Clients often describe this pain as sharp, throbbing, aching, or crushing, which matches the client's reported pain description. Somatic pain is typically well localized and responds well to treatments like non-steroidal anti-inflammatory drugs or opioids. Let us now proceed to question 68. A client's chest tube has been functioning well for several days after treatment for a pneumothorax. Now, the healthcare provider has written an order to remove the chest tube at the bedside. As the nurse prepares for this procedure, which of the following supplies is most essential to have ready at the bedside? Here are the options. Option A, suture removal kit. Option B, bag valve mask resuscitator. Option C, low-flow oxygen via nasal cannula. Option D, wall-mounted suction with tubing. And the correct answer is option A, suture removal kit. Here's the rationale. Chest tubes are often sutured in place for security, and when it is time to remove them, these sutures must be removed under sterile conditions. A suture removal kit, along with occlusive petroleum gauze, dry sterile gauze, adhesive tape, and a biohazard bag, are the most essential supplies for bedside readiness. In addition, nurses should provide analgesia about 30 minutes before the procedure and be prepared for post-removal imaging to confirm lung re-expansion. Let us now move into question 69. A client in a psychiatric outpatient clinic states to the nurse, "I am going to kill my wife the next time I see her." The nurse immediately recognizes this as a direct, imminent threat toward an identifiable individual. So, what is the most appropriate initial nursing action in response to this statement? Here are the options. Option A, maintain therapeutic rapport by preserving client confidentiality. Option B, thoroughly document the client's statement and observed behavior. Option C, immediately notify the mental health provider of the threat. Option D, encourage the client to explore the root of his anger toward his wife. And the correct answer is option C, immediately notify the mental health provider of the threat. Here is the rationale. In situations where a client makes a specific and credible threat toward an identifiable person, the nurse has both a legal and ethical duty to act immediately under what is known as the duty to warn or duty to protect principle. This legal obligation overrides routine confidentiality and requires that the nurse immediately notify the psychiatric provider or designated authority. That action may prompt additional steps, such as alerting law enforcement or the potential victim, depending on local laws and facility protocol. Let us now continue with question 70. A nurse specializing in reproductive health is conducting preconception counseling with a 32-year-old female client who has been trying to conceive for the past 6 months. As part of the session, the client asks a very common and important question. Which hormone actually causes the egg to be released from the ovary each month? Here are the options. Option A, estradiol. Option B, androgens. Option C, luteinizing hormone LH. Option D, human chorionic gonadotropin HCG. And the correct answer is option C, luteinizing hormone LH. Here is the rationale. Luteinizing hormone, or LH, which is secreted by the anterior pituitary gland, is the primary hormone responsible for triggering ovulation. Around the midpoint of the menstrual cycle, typically day 14 in a 28-day cycle, rising estrogen levels from the dominant follicle cause a sudden surge in LH. This LH surge causes the mature follicle to rupture and release an egg, marking ovulation. Additionally, LH also plays a key role in converting the ruptured follicle into the corpus luteum, which produces progesterone to help support a potential pregnancy by preparing the uterine lining for implantation. Let us now move on question number 71, which focus on a fetal monitoring scenario that tests both clinical understanding and appropriate nursing response. The nurse is reviewing a client's contraction stress test, which has come back positive. In this case, which action should the nurse take based on the results? Here are the options. Option A, obtain an order for a biophysical screening. Option B, document the results as within normal limits. Option C, perform Leopold maneuvers. Option D, obtain a urine specimen and assess for proteinuria. And the correct answer is option A, obtain an order for a biophysical screening. Here's the rationale. A positive contraction stress test is considered a non-reassuring finding. It means that late decelerations were observed in at least 50% of the contractions, which strongly suggests uteroplacental insufficiency. This condition increases the risk of fetal hypoxia, growth restriction, meconium-stained fluid, low APGAR scores, and even stillbirth if not addressed promptly. Therefore, the nurse must act quickly by obtaining an order for a biophysical profile, a comprehensive test that includes ultrasound assessment of fetal tone, movement, breathing, and amniotic fluid volume, along with fetal heart rate monitoring. This next step helps determine the overall stability of the fetus and whether further intervention or delivery may be needed.